Thank you all so much. My name is Vicki Lehman, and I'm the Community Engagement Specialist at Child Care Answers. Child Care Answers is the local child care resource and referral agency. We serve Hamilton, Hendricks, and Marion counties. We are a nonprofit operating on a contract with the state of Indiana, and we work with families to help them find child care, connect to additional resources. We provide parent education, different things like that. We are also working in the community with businesses and employers and helping advocate for early childhood education. And we work with child care providers to help them get connected and get their business started. So we are so excited to welcome Ann with the Indiana Rural Health Association today. Ann is going to talk to us about understanding the basics of health insurance. So Ann, I'm going to hand it over to you and we can go ahead and get started.
Thank you, Vicki, and thank you so much for inviting us to share our program today. This is a great opportunity. I have to say this is one of my favorite presentations. There's no boring stats or graphs included in this one. This is just a high-level look of options in Indiana for working families or families who are transitioning from one job to the other or maybe affected by the COVID layoff. So again, Vicki, thank you for having us. And we're going to dive right in so we can get through this and then hopefully have some time for questions at the end or just a little feedback. Any questions you might want to ask, Vicki. So with that being said, I'm going to go ahead and advance my slide, hopefully. So I'd like to start by asking you to do a little word association exercise. And I left this slide blank on purpose because I want you to be free from any distractions. So clear your mind, blank slate. When I say progressive insurance, what is the first thing that pops into your mind, if anything? Now, when I say flow from progressive, does your mind immediately recognize the name? And does Flow face pop into your mind? And there she is. So I'd say that's some powerful branding. Flow's been around for a little bit. And why does she work so well as the face of progressive? And how does Flow fit into our time together today? I have actually been compared to Flow. And the first couple of times it happened, I was not quite sure how to take it. Is that a good thing or a bad thing? Well, let me tell you, it's a good thing. And I do see it as a compliment. And here is why. Flow humanizes insurance, something that can feel pretty impersonal. And VCU Brand Center professor Kaylee Caldwell goes on further to say, we are paying for something we hope we never need. And if we do need it, we want to believe that it will be easy and human. Flo seems like the kind of person we would hope to get on the other end of the line to help us through an unpleasant situation. And that is exactly my hope for our time together today. And again, no boring graphs or charts. This is one of my favorite types of presentations. So my hope is just to provide that human side of insurance, something we all need, something we all have in common, and something that can be difficult to navigate. So with that being said, the learning objectives are pretty simple today. Explain the different health insurance options in Indiana. Explain and compare cost and eligibility requirements for different health insurance programs. And then explain the role of an insurance navigator and how that differs from another role of those who might offer assistance, such as a health insurance agent or a health insurance broker. So to kick off, a few introductions and a little bit of my background. My name is Ann, and I'm a Department of Insurance certified Indiana Navigator at Indiana Rural Health Association. I'm a project coordinator for IRHA's service project called Connecting Kids to Coverage Indiana. So let's break that down a bit. Who is Indiana Rural Health Association, or IRHA, and what do they do? IRHA was founded in 1997. They're a member-driven, not-for-profit organization. These members are made up of individuals, healthcare organizations, statewide facilities, and community partners that collectively work toward improving the health of Hoosiers living in rural areas. This is done by assessing the strengths and weaknesses within the rural communities through community assessment to ultimately provide resources and solutions for identified statewide communities to implement our mission of enhancing the health and well-being of those facing challenges to achieve these outcomes. So one such challenge is affordable health insurance. Indiana Rural Health Association provides free and unbiased assistance to Hoosiers through our Connecting Kids Coverage Indiana project. This project is funded through a cooperative agreement awarded to IRHA by the Centers for Medicare and Medicaid Services. It is a national campaign with 39 grantees, and it is the first time IRHA has been the recipient of this award. Our project team is made up of 4, and we are all certified through the Indiana Department of Insurance as Indiana Navigators to provide this assistance. And I'll talk a little bit more about the specifics of this role in more detail for the end of our time together. So just to kind of get the necessary out of the way, this is our disclaimer, our funding opportunity number. So if you'd like to look that up, this has been provided. Now we're going to kind of look at some options for insurance in Indiana. What are some of the paths that you might have to obtain coverage? So I've listed a few, and I'm not going to talk about all of them, but I just want to highlight them real quick on the list. Employer health insurance plans, retiree plans, COBRA, marketplace plans, Medicare Part A, there's all kinds of parts to Medicare, Medicaid, Children's Health Insurance Program, or CHIP, student health plans, VA plans, and TRICARE plans. And again, you can see by the yellow arrows, I've kind of highlighted a few, and these are the ones we're going to kind of pinpoint in on today and talk about in a little more detail. And then you also notice the big green check mark. And why does this list have a big green check mark? The reason these plans have been identified is because they all qualify as qualified health plans. What does that mean? And I'm going to call these QHPs going forward. So a qualified health plan is a QHP. And this is a plan that provides essential health benefits and follows the established limits on cost sharing and out-of-pocket maximum amounts. These plans meet the requirements of the Affordable Care Act by providing a core set of benefits that include preventative services, mental health services, substance abuse services, emergency services, prescription drugs, and hospitalization coverage. So in other words, they have a standard set of coverage requirements. QHPs must also offer a minimum actuarial coverage of 60%, which is the amount that they have to cover for services. These plans, of course, can offer a higher AC or actuarial coverage percentage, but again, the plan must at least cover 60% of expected costs for an individual. So I've identified a few, again, QHPs, and you'll notice a couple of them have asterisks by them, and that's because they have a bit of a caveat. For instance, Medicare, you have to have several parts of Medicare to make it a QHP. I'm not going to dive into all that today. If you have more questions, I'm certainly happy to talk about that. But let's look at some that you may be familiar with that you maybe assumed were health insurance plans, but they actually are not. And you're going to understand why now that you have been equipped with this little knowledge of, I know what it takes to be a QHP and what's not a QHP. So health plans that don't count as coverage. So the first one's pretty explanatory, just a standalone plan. It's dental and vision only. Your employer may only offer this type of coverage to employees legally, unless you have a employer that has more than 50 employees. They legally don't have to offer health insurance, but they may offer a dental and vision plan. We know now that that doesn't cover all the things that it has to. So a standalone plan like a dental and vision plan would not be considered comprehensive coverage. The second one is workers' compensation. Some employees require that all their employees have workers' compensation insurance. And workers' compensation is limited to those workplace accidents or illnesses or an injury on the job. So it'll only cover those claims. So if you only have workers' compensation coverage, you do not have a qualifying health coverage plan. And then there's coverage for a specific disease or condition. I think one that people are probably familiar with is a company called Aflac. Aflac offers supplemental plans, and these plans are supplemental to the health coverage that you might already have. For instance, they cover a cancer care in addition to your normal health insurance, or emergency room visit, or what's the other one that they have? Accident insurance, critical illness insurance, hospitalization supplement. So it's just a little extra to what your normal plan might not cover that might help you reduce costs. But remember, Aflac in itself, these standalone programs are not health insurance coverage. And then the last one, plans that offer only discounts on medical services. And these seem to have gained in popularity. And they may present themselves as a QHP, and you have to be pretty careful when you start listening to all the details. One that I've heard a lot about lately, and I've actually had clients call me and ask me about, is sidecar health. Sidecar health is not a QHP as defined by the ACA. Rather, packages, again, are purchased that cover what you anticipate you will need. So you kind of buy into a plan. Now, as a navigator, my job is not to tell you whether these are good or bad, or what you should do or what you shouldn't do. My job is simply just to inform you of what a qualified health plan is and what's considered supplemental and wouldn't be backed by those same protections that an ACA QHP might have. So again, I'm not saying these are good or bad. I'm just simply trying to kind of educate you on your options. And the best way to do this is kind of to hold them all to a litmus test. And that litmus test is this. If you want to know you have a QHP, there's two things you need to ask. Does this health plan pay at least 60% of the total cost of the medical services for a standard population? That's that actuarial value. And the health plan, does it cover those 10 minimum essential benefits that define it as a quality health plan? And those 10 are listed on this slide. As you can see, laboratory service, emergency services, prescription drugs, mental health, and on for 10. And again, just be careful when selecting a plan that you know that all of these things are indeed covered. So then moving along, let's talk about employer health insurance, or you might hear it called group health insurance. And I'm not going to spend a whole lot of time on this because this is a great place for you to talk to your HR, your benefits specialist, if you have a new job or transitioning jobs and you have those type of questions. But I am including a little checklist that might help you know what questions to ask. And remember, we're already smarter because we know we're looking for a QHP, but also ask if the health insurance is offered, and are you eligible as an employee? Do you have enough hours? If you're part-time, you may not qualify. So if they offer it, ask if you're eligible. Ask if they provide an information summary for health insurance plans offered, so you can see exactly what it covers and what it doesn't cover. You can make sure it's not just a standalone dental or vision plan. Ask if your spouse, domestic partner, or your children or dependents are eligible to enroll into this plan as well. And ask when and how your open enrollment occurs. Most employers have a set of time that you can only enroll, maybe 60 days after you start employment or during a period of time in the year. So you want to make sure you don't miss that. And after you've enrolled, when will those benefits actually start? If you should lose your job or leave your job, ask how long you can keep those benefits after your employment ends. And then always make sure you know who your contact person is at your company, so when you have additional questions, you know who to contact. So what if you don't have access to health insurance through your employer? Now we're going to shift gears and talk about a couple different programs in Indiana that you might qualify for. So we will talk about who's eligible for these and where you go to find assistance and enroll in these plans. So the first one we're going to talk about is Medicaid. And Medicaid has several different programs under that umbrella. But the two that we're going to talk about is HOOSIER HEALTHWISE and Healthy Indiana Plan. HOOSIER HEALTHWISE is an Indiana healthcare program for children ages 0 up to age 19 and some pregnant women. And then after age 19 through 64, or at the age of 19 through 64, there's a program called Healthy Indiana Plan, which is Indiana's expanded Medicaid program. So to apply for either one of these programs, there are eligibility criteria that have to be met, and you will need to provide information. And this information might include names, dates of birth of household, social security numbers, information about your income, both earned and unearned income, and your family and tax relationship. So to qualify for Healthy Indiana Plan, family has to be below 138% of the federal poverty level. Now, most people don't know what that cutoff is, and I have to look at this chart myself, so don't get nervous. We're going to help you cheat a little bit. To give you an idea, a household, one person, one individual, let's say we have a 20-year-old that is interested in this program, as long as his income is under $1,482, he could qualify for Healthy Indiana Plan Plus. Now, keep in mind, this is gross income. So this is income before all your taxes come out and your expenses, unfortunately. So this is just your adjusted gross income. And then you can see as your household size increases, so does that eligibility standard. Healthy Indiana Plan offers a low-cost, full comprehensive coverage plan. The preferred plan is called Healthy Indiana Plan Plus. The Plus includes dental, vision, and chiropractic coverage. As long as you make a contribution that is dependent on your income, it could be $1 to $20 a month, you will get these Plus benefits as well, with no copays for prescriptions or doctor visits. Members can choose from 4 managed care entities. Managed care entities, that's just a fancy way of saying your insurance company. They actually handle your claims. Healthy Indiana Plan is managed by Anthem, CareSource, MedWise, and MHS in Indiana. Members can actually earn rewards for wellness and healthy choices that in return can help cover that contribution going forward. Really some great options with Healthy Indiana Plan. Now I mentioned that HIP Plus is the preferred plan. There is a HIP Basic coverage as well. And what this HIP Basics does is it kind of protects members that fall below 100% of the FPL level. So let's look at that eligibility slide again. So we've got HIP Basics. So this is 100%, 1,074. Because there is that payment requirement, if you're in HIP Plus and you fail to make your payment or your contribution for more than 2 months, instead of losing your coverage totally, you'll default down to HIP Basic, which still covers the minimum essentials, but you won't get those added benefits of that dental, vision, and chiropractic coverage, and you may have some copay charges that you won't have with HIP Plus. All right, so Hoosier HealthWise. Again, Hoosier HealthWise is the program for Indiana residents ages 0 up through 19. There are 2 packages for Hoosier HealthWise. Package A, which is a no-cost insurance, and then Package C, which has a low-cost option. And again, these are based on income eligibility guidelines, coverage that these include the full service plan. So remember, it's QHP, so you can rest assured in that. Package A has no copays or premiums or cost share expenses, the 12-month eligibility period, and you can choose your own provider. Package C, very, very similar. There are some lower costs associated for copays, premiums, and some cost-sharing fees. You can also choose your provider for this package as well. Now, I want you to see what happens to those income guidelines. If you look at Package C here, remember we talked about the federal poverty level. There is a eligibility criteria that a household must remain below 250% of the federal poverty level. So that's a lot more generous than that 138% that Healthy Indiana plans to offer. So let's look at that real quick. So maximum family income for Hoosier HealthWise eligibility. Let's say you're a household of 4. You'd like to get your children insured through Hoosier HealthWise Package C. You can actually see that a household of 4 there to qualify would need to have that adjusted gross income amount of $5,631 a month or less. And I'm going to flip back. Family of 4 for Healthy Indiana plan, $3,048 for that household. So you can see it's a lot more generous. So you may assume that your children won't qualify for insurance through Medicaid because you as an adult, 19 to 64, don't qualify. But this might be a situation where you can help keep those costs down, free up your budget a little bit by putting your children on that low cost Package C, and then seeking insurance elsewhere as an adult for those in your household. What are those options for the adults? If you're an adult and you don't qualify for a Healthy Indiana program, you've got your kids in Package C, Hoosier HealthWise, but you still need insurance. Your employer doesn't offer it, or you don't have access to it, you're self-employed. What are your options? So one of the goals that the Affordable Care Act implemented was to make affordable health insurance available to more people, and this was implemented through the marketplace. The marketplace is basically a service that helps people shop for and enroll in health insurance, and these are all QHP plans. It is operated by the federal government in Indiana, and these plans are made available through healthcare.gov for most states, including us in Indiana. Consumers may qualify for cost savings subsidies as well, based on income and household size. So we quickly looked at some options. We looked at employer insurance, and a quick checklist was provided that might help you know the questions to ask your HR or your benefits specialist at your employer. We looked at Medicaid programs, which do have eligibility standards, including Indiana residency, citizenship, lawful permanent residency, income guidelines. And then we looked at Marketplace very quickly. And we know that there's an option with Marketplace that you might qualify for additional cost savings. So it's a lot. Where do you turn for help? We quickly went through this. So a couple questions. Have you ever heard of an insurance navigator? Or have you ever wondered what the difference between a health insurance agent and a health insurance broker is? Let's just break it down real quick. An agent and a broker share a lot of things in common. They're both trained insurance professionals who can help you enroll into an insurance plan. They are both licensed in their state. An agent may work for a single health insurance company, like you may be an agent for Anthem, whereas a broker may represent several different insurance companies. A broker may be paid commissions from insurance companies that he partners with for selling their plans. And then both an agent and a broker can assist you on enrolling into a health plan through the health insurance marketplace. So how does that differ from a navigator? A navigator is also licensed by Indiana Department of Insurance, and they can also help you complete the application, follow your application status, and remind you of missing documents. Big difference, we are free. We're not commission-based. We offer a free and unbiased service just to help you navigate through this enrollment process. We'll kind of put it side by side. Why is the navigator so important? Free, yay, free is always good. Unbiased, yes. Again, I mentioned this earlier. It's not my job to tell you what you should get or what you shouldn't get, what's good and what's bad. My job is to just guide you through the process, answer questions about eligibility and enrollment in the different programs available. We are not agents or brokers. We have different licensing requirements. We do receive training. We have to take a test. We have to go through continuing education, and we have to stay licensed with the Department of Insurance. Again, we don't recommend plans, and we can help consumers apply for Medicaid, which we talked about, the Children's Health Insurance Program, HOOSIER HEALTHWISE, which we talked about, and then Marketplace plans, which we also talked about. Where do you find navigator assistance? As I mentioned, our project team has 4 licensed navigators. That's not very many for a big state. So we've partnered with other agencies, and here's a list of where you might find those. Covering Kids and Family is a great resource, and we've included their phone number. They can get you in touch with one of these free navigators. Of course, us, Connecting Kids to Coverage, and our contact information is included. And then Indiana's federally qualified health centers. A federally qualified health center has navigators available for assistance. And if you'd like to find one in your area, you can visit findahealthcenter.hrsa.gov, type in your zip code, and it'll give you a list of FQHCs in your area that can connect you to a navigator. And then claim aid, you'll often find claim aid in hospitals. So if you have an unfortunate event and you find yourself in the emergency room, let's say, and you're uninsured, Claimade might be able to assist you with that. Back to that blank screen, we're going to do that word association thing again. So, talked about flow. And now I'm hoping that when you hear Indiana Navigator, or you hear IRHA, or you hear Connecting Kids to Coverage, kind of like flow, now think of an Indiana Navigator that you've known and you've met. So when you hear insurance and you need a little assistance, think of me, reach out to Vicki through Child Care Answers. I've included this little fancy QR code. We all know what these are now from going to restaurants and pulling up menus. If you just hold your camera up to that square, it'll actually connect you to our team. You can provide some quick information, and we will reach out to you within 3 business days and start your assistance right away. So really neat way to get a hold of us. We want to keep it as easy as possible. And there's my contact information. You can always email me. Again, visit our website. However's easiest for you. Just again, remember that word association, Connecting Kids to Coverage, insurance, gonna call Ann. So that's it. Thank you, Vicki, for letting me share. I hope this was either a great learning tool or maybe just a refresher course, and some new information was taken away today.
Thank you so much, Ann. This was fantastic, super informative, tons of information. You did a really great job of laying it all out and making it make sense